So your periods are the worst and you don't know why. Well, what might be wrong and when do you need to go to the doctor? Let's talk about it. The female reproductive system is a combination of special organs and hormones. The uterus is a pear-sized muscular organ that develops and sheds a cushy uterine lining each month, and that lining is called the endometrium. There is also a pair of almond-sized ovaries that produce the female hormones estrogen and progesterone and release a mature egg cell each month. The fallopian tubes are thin tubes that connect the ovaries to the uterus and help guide the egg to its proper place in the uterus. And finally, there is the vagina, the muscular canal that connects to the outside of the body. A closer look into the ovaries would show thousands of follicles with an immature egg cell inside. Each month, a follicle produces estrogen to grow and mature its egg, and then that matured egg is released for a chance to be fertilized and become a baby. After the matured egg is released, the remaining follicle cells turn into the corpus luteum, a structure designed to release the hormone progesterone. And that progesterone tells the uterus to prepare to be extra cushy because an egg, and possibly a baby, is heading its way. So the female reproductive system has two big jobs to do each month. One is that the ovaries have to make our friends the follicle, the mature egg cell, and the corpus luteum. Two is that the uterus has to develop a cushy lining for a potentially fertilized egg to implant into. And we want these two big jobs to be in sync with one another, where the uterine lining is ready just as the egg is arriving to the uterus. And we want our periods timed as an important reset. So here we can see that the period phase lasts about a week, and our new follicle and egg are just starting to develop. In the week following our period, week 2, the follicle and egg finish maturing, and about 14 days after the first day of your period, the mature egg is ready to be released, called ovulation. It takes a few days for the egg to travel from the ovary through the fallopian tube into the uterus, at which point the corpus luteum is telling the uterus to finish preparing its thick lining in week 3. And in week 4, the egg will either be fertilized and implant into the uterus, resulting in pregnancy, or it will not be fertilized and not implant, and the body will prepare for another period. Time to reset and start over. Most women have a period, the shedding of their uterine lining, once a month. It lasts 4 to 6 days with a little bit of cramping. But for some women, their period cramps are unbelievably painful, and this is called dysmenorrhea. Dys meaning bad, and menorrhea meaning period, so bad period. Women with dysmenorrhea produce more prostaglandins, an inflammatory hormone, when their uterine lining begins to break down. And those prostaglandins make uterine contractions extra strong and extra painful, resulting in painful period cramps. Because the bad cramps are largely caused by prostaglandin release, the best treatment for dysmenorrhea is ibuprofen or naproxen, because these medications directly block the body from producing prostaglandins. It is most helpful to take a dose of ibuprofen or naproxen every 4 hours starting the day before your period, and for 1 to 2 days after your period starts. If ibuprofen doesn't work for you, try naproxen, and vice versa. But if your cramps are still painful even with medicine, then talk to your doctor about trying an oral contraceptive. This next period problem is called endometriosis, and it happens when endometrium, the uterine lining, is misplaced and keeps growing outside of the uterus. Endometriosis can be quite painful because the uterine lining keeps growing and shedding, but there's no place for the blood to go. Common places for misplaced uterine lining to end up include ovaries, the fallopian tubes, outside the uterus, and even on the bladder and large intestines. This can cause a lot of different problems, and each woman with endometriosis will have her own collection of symptoms. Most commonly, they will have painful periods, and less common symptoms include pain with sex, pain when using the bathroom, back pain, and infertility. Endometriosis can be a serious condition that can get worse over time, so it's best to be evaluated by a gynecologist. Initial treatment will likely include ibuprofen to help with pain during your periods and a contraceptive pill to lighten your periods. There are more treatment options available if you're still experiencing symptoms, and your doctor will help you choose what's best for you. The final period problem has a long name, polycystic ovarian syndrome, or PCOS. The two key features of this condition is that the uterine lining overgrows, gets extra thick, and the ovaries have many cysts on them, hence the name poly for many and cystic for cysts. In simple terms, PCOS is a result of hormone imbalance with too much estrogen, too much testosterone, and not enough progesterone. Going back to our charts from earlier, we can see how estrogen signals the follicle to grow and mature into an egg. Estrogen also tells the uterine lining to start growing. After ovulation, egg release, the corpus luteum releases progesterone that signals the uterine lining to get thicker and cushier to be ready for the egg. And then as both estrogen and progesterone levels fall, the uterine lining breaks down and is shed during the period. In PCOS, however, all the extra estrogen makes lots of follicles grow, and these follicles become the ovarian cysts. And the constantly high estrogen with low progesterone means the uterine lining grows, but never gets a clear signal of when to shed, meaning periods are irregular. And too much testosterone means women with PCOS are more likely to have facial hair and acne. Altogether, women with PCOS tend to have late periods. Due to their hormones being off balance, they may not be able to mature and release an egg cell properly, called anovulation, resulting in reduced fertility. They are more likely to have male-patterned hair growth, like facial hair and acne, and they have an increased chance of obesity and diabetes. If you are concerned that you may have PCOS, it's best to see a gynecologist to be evaluated. The best treatment for women with PCOS who are overweight is weight loss. Losing weight can help bring your hormones closer into balance and help regulate your periods. In addition to weight loss, your doctor may recommend starting a contraceptive pill. Because women with PCOS have high estrogen and low progesterone, a contraceptive pill is helpful because it provides your body with much needed progesterone, which helps regulate your periods. So that's that, the 3 most common causes of period problems and what you can do about them. I hope this video helped, and I hope you understand and can cope with your periods just a little bit better. This is Dr. Says, encouraging you to live happy, healthy, and bold. Bye!